Hi, this is Jason Lovejoy, and this is our court interpretation on cone rod dystrophy presented by Randallyn Burnett, Melody Ely, Shelley Ellis, and Jason Lovejoy. And the picture on the right of the slide is a family, a mixed race family. Looks like a grandmother holding a granddaughter on her shoulders with mother on the left and father on the right. This slide is subjective information reported by the mother. I will read them for you. I just wanted to confirm some information with you that you've reported. Is that all right? I will ask some quick questions to answer and confirm. You are here with your daughter Jane in relation to cone rod dystrophy diagnosis, correct? Jane was carried to full term and delivered via vaginal birth at 7 pounds 12 ounces with no health issues, right? Jane's cone rod dystrophy was diagnosed by a doctor at age 7, and she was referred to a pediatric ophthalmologist who confirmed the disorder, correct? Jane has no ocular or cerebral trauma in relation to her vision issue, is that right? Jane currently has prescription lenses and hasn't worn them for 2 years. Does she have an updated prescription? Do you have any questions or additional information for me at this time? And this is a student subjected history recorded by the mother. Jane has demonstrated visual problems since the age of 3. While at home, she is able to get around independently in familiar settings. In new settings, her preference is for family to be close by. Jane is able to catch a ball and play on the playground successfully. Jane holds books and worksheets about 1 inch away from her face and moves the paper around while reading them. Jane reads on grade level, but reports after 10 to 20 minutes she does not want to read because she can't see. Larger print books have been introduced, and she is able to sustain focus much longer. This is subjective family history by the mother. You have stated that there is a history of diabetes mellitus that specifically includes an uncle, an aunt, and mother. And you're aware that diabetes mellitus is the body's resistance to insulin, which is untreated can cause complications in vision due to diabetic retinopathy. Diabetic retinopathy can present many associated problems with vision, including color blindness, night blindness, and central vision loss. You've brought your other 2 daughters in for testing as well. Have you had your son and other daughter tested who are here with you today? Has this testing been performed on them? Has the doctor also suggested genetic testing for your family, ruling out Alström syndrome, as well as testing for diabetes? Will be objective information by Shelley.
Thank you, Jason. So I will be interpreting the eye report, the eye exam for the family, or maybe somebody on the team that needs an explanation. During her last exam, your daughter was seen by a new doctor where they dilated her eyes with medication and used a special camera to get a look at her retina, which is in the back of her eye. The doctor was able to get a good look, and the appearance of her eyes look healthy and normal in many ways. Her peripheral vision at this time is functional, meaning she has usable vision on the sides of her as well as straight ahead. The doctor also performed a color test to determine her ability to see colors, also called color vision. Through these tests, he was able to confirm her diagnosis of cone rod dystrophy, which was originally diagnosed 4 years ago. And this is a condition that affects the retina by causing the photoreceptors, her cones and rods, to break down. Jane's condition, the cone rod dystrophy, is hereditary and is also degenerative, which means her vision will worsen over time. She's currently experiencing early symptoms with her decreased visual acuities and decreased vision. The doctor performed a vision acuity test. He used a standard chart and noted the results. What that means is that her distance vision in one eye without correction is in the other eye. Means that what she sees at 20 feet, someone with normal vision would see from 300 or 400 feet away. The doctor did a standard near vision test, and without correction in her right eye was 2200 and 2100 in her left, which means that when the standard chart was placed 14 inches away, she could only see the very largest letters. Testing with correction with her glasses or with correction was not noted in the eye report. The doctor did make some notes, and he said that due to her severe visual limitations and decreased color vision, that she is considered legally blind at this time. The doctor feels that wearing glasses may help magnify her near vision. He did prescribe a bifocal or progressive progressive lens, but he did not note what the corrected vision would be like. She should continue to receive her vision services. And he also mentioned that she is learning Braille and orientation and mobility techniques. She should return in a year for another exam. Melody?
Thank you, Shelley. We have optical assessment, cone dystrophy. Jane has been diagnosed with cone rod dystrophy with severe visual limitation. I have a picture here of an eyeball lit up. The left shows a normal retina, which is an orangish color with a yellow glow on the left-hand side where the veins go in. The right-hand side shows an eyeball that's been lit up, and instead of there being a yellow spot, there's a whitish spot, and it's very speckled in comparison. So your daughter achieved about 8% in the color test in each eye. She got 1 out of 13 correct on the that she was given. The assessment would have been similar to this one, where she would have to identify the numbers that are tucked in a whole bunch of color, just to give you an idea of the impact of her color vision. Your child has eyes that are more sensitive, but there are many ways to work around it. And on this page is a little tips chart where there are some cartoonish figures. One says, accept your needs, it's okay, and you are not alone, emphasized. Use items that can help you, and there's a picture of sunglasses. And then on the bottom one, there's a boy and girl talking, and it says, don't hesitate to ask for accommodations when needed. In this picture, or this next slide, it says your child will develop blind spots starting on the outside and working in. As she gets older, her blindness will get worse. And there is a picture here of a person who is driving, and there is a person on the left in a red dress kicking a ball across the highway. The driver with normal vision can see this person, but the driver on the right who has the peripheral vision issues on the outside does not see the child and would probably hit them. So night blindness occurs when either the rod cells or the pupils are not functioning, and your daughter is going to struggle with this. So if she goes into a darkened room, you may see her pause a little bit. There's a picture here of night vision with a line of cars. Vision is on the left-hand side where you can see a variety of colors in a city view with cars in front of you, red lights at the parking brakes, and headlights. On the right-hand side, you can barely make out red and some whitish light. It shows that it's much harder to see detail. It shows a typical graph of vision. You can see the tracking of the eye and visual fields that go towards the outside. And so in this picture are 2 circular graphs. At the center of the graph is where there's an empty spot. So there is a small darkened area that shows our blind spots in normal vision. And then around that are some pretty much circles that show our near vision. And then for the peripheral vision, you'll see how the circles, instead of becoming wider circles, they're impacted by the bridge of the nose. And so they get wider towards the outside, towards the sides of our ears. So this is an example of a normal, typical graph of vision. This is your daughter's vision at this point. This will help to assess how her vision is impacted in later years and the rate of progression towards blindness. In this picture, you'll see that the blind spots are much larger than the previous picture, and her vision is quite impacted with sharper, less rounded areas. Her fly test, which took a look at how her eyes are working together and the ability to judge distance and depth perception, was about 56%. So that means in this picture that's shown here of a long white hallway decorated with red chairs, and it's a very long hallway, she would only be able to perceive about half of it as the chairs go further away and as they get smaller. So this will be difficult for her to navigate. And now we have treatment, prognosis, and accommodations by Randolyn.
Thank you. All right, treatment, prognosis, and accommodations. First is the cone rod dystrophy. There is no cure for, but there are some treatments that can slow down the progression or assist in helping your daughter adapt to her vision loss. So the first is, of course, prescription glasses. That's like having a built-in magnifier so that she will be able to see further and in more detail than without them. It will not give her full 20/20 vision, but it could help so that she may not need to use certain devices when she's sitting at the front of the room. So it's something to consider. Sunglasses and tinted glasses are excellent for blocking sunlight. Sunlight is going to cause the breakdown of the retinal cells and the rods faster. So avoiding direct sunlight is ideal, especially sunlight into the eyes. So sunglasses, tinted glasses, or even hats will help a lot. There are some vitamins that have been shown to slow down the progression, but this is something you have to talk to your eye doctor about. They're the ones who know what combination and how much. Next time you take her in, if you want to ask them about the vitamins, that would be a great chance to do so. There are low vision devices that we can provide her and can be prescribed to her even during a low vision clinic that will assist her in being able to see the board or her paperwork or anything else when it comes to school and accessing her environment. And then the most important thing to do is get regular checkups and eye exams every year to monitor it so that they can figure out how fast she's losing her sight so we can make adaptations to help her. So the prognosis, cone rod dystrophy, usually starts in childhood, almost all the time. And the first symptoms will often occur before the age of 10. So she's right in line for the typical individual with cone rod dystrophy. By 20, most of the individuals meet the criteria for legal blindness. Now, your daughter, Jane, does already meet that criteria. So genetic testing can help you determine the type and how quickly it's going to progress. It's something to talk to the eye doctor about because they would know who to send you to and how much it's going to help you. There are different symptoms that she may experience over time, including the loss of the central vision, sensitivity, loss of color vision, which she's already experiencing. Connected to the color vision loss will be contrast sensitivity, night blindness, and peripheral vision loss. Now, the most advanced stage is when you become an adult later on. Often it happens around like age 40. It was averaging out, and that's when it's a total vision loss. Now, there's a lot of accommodations that can be provided to help Jane access the school and her environment. Because of the night blindness and the fact that her vision will be getting worse, we recommend training with orientation and mobility and using white canes, especially at night. We also recommend Braille training so that no matter when she may lose her ability to read print, she can move into the next and not lose her ability to keep up in class or lose her ability to read altogether. We can also do large print so that it makes it easier and less strain on her eyes so she won't be as tired. We can provide magnifiers, preferential seating. She'll need extra time for travel and for schoolwork. And we'll provide descriptions of images. This is super important since one of the first things she's lost is the ability to tell all of the colors. So getting a description will help her analyze things at the same rate as her classmates. And then high contrast materials and markers to use on whiteboards. This is not an extensive list of accommodations. This list will change as she goes through school. She may decide she likes certain things, or we may find something that we need to add in or take out. This is just a basic idea of some of the accommodations. At this point, it's really important to have an open conversation with the parent and the student, if they're there, about any concerns, questions, or comments that they might have had after this presentation. So we would be talking to the parents in a very informal way about what might be coming and how vision services can help Jane access her curriculum. Thank you for listening to our presentation.